azithromycin. Now coming to the anti-tubercular drugs. Now, anti-tubercular drugs are classified into first-line drugs and second-line drugs. First-line drugs are having more efficacy and less toxicity. They are used routinely. Under the first-line drugs, we have isoniazid, we have rifampicin, pyrazinamide, ethambutol, and streptomycin. Then there are the second-line drugs which have less efficacy, more toxicity, or both, and they are used in special circumstances only. Now, under the second line drugs, we have fluoroquinolones like ofloxacin, levofloxacin, moxifloxacin, ciprofloxacin. Then there are the other oral drugs like ethanolamide, we have cycloserine, para-aminosalicylic acid or PAS, and rifabutin. Then there are the injectable drugs like kanamycin, amikacin, capreomycin. Now, there is another classification by WHO in 2010 and the Revised National Tuberculosis Control Program, RNTCP. It is the DOTS plus guidelines, which have alternative grouping of the anti-tubercular drugs, where the anti-tubercular drugs are classified into 5 groups. But we will not go into details of this classification, which is almost similar, but then they are classified into 5 group of drugs. Now coming to the first line anti-tubercular drugs. Now a full question can be asked on the anti-tubercular drugs, the first line drugs especially, and the toxicity. And the toxicity part is very important, as well as the classification of the first line as well as the other drugs, second line drugs. Now coming to the important features, again, any one drug can be asked. The important features of any one of the drugs can be asked. Isoniazid, or H in short, which is having a bactericidal action. It is a cheap drug. Mechanism of action, it acts by inhibition of the synthesis of mycolic acids. It is one of the important constituents of the mycobacterial cell walls. So that is how this drug acts, isoniazid. It is used orally, and there is a genetic variation in the acetylation status of INH. There are fast and slow acetylators, Indians which are generally slow acetylators, and peripheral neuritis, which is a side effect which is more common in slow acetylators. Now, this peripheral neuritis, which can be prevented by giving pyridoxine prophylactically 10 milligrams per day. So that is how peripheral neuritis can be prevented. Because hepatitis, this drug is toxic to the liver. So again, this is a side effect related to isoniazid or isonicotinic acid hydrazide. Then the other important drug, first line drug, which is rifampicin or rifampin. Now this again is having a bactericidal action. It acts by inhibiting the DNA dependent RNA synthesis. It is a microsomal enzyme inducer. Again, side effects which are related to rifampicin or hepatitis, and this drug also causes the urine and the other secretions to become orange red in color. Of course, this is a harmless side effect, but it has to be told to the patient in the beginning. So these are the side effects related to rifampicin. The other uses of rifampicin are in case of leprosy as a second line drug and in the prophylaxis of meningitis. These are the uses of rifampicin. Coming to pyrazinamide. Now, pyrazinamide again is having a bactericidal action. Now, when this drug is added to the regimen, the duration of treatment is reduced, as well as the risk of relapse again is reduced. So, therefore, this drug is included in the therapy for tuberculosis. Now, coming to the mechanism of action of pyrazinamide, it is similar to INH. Again, this drug causes hepatotoxicity, which is a major side effect related to pyrazinamide. Then we have ethambutol, which is having a bacteriostatic action, again, which is included in the first line drugs. The main side effect of ethambutol is optic neuritis. So, this side effect is again should be kept at the back of the mind, and the patients um, should be asked about the condition of the ocular about vision. Now coming to streptomycin, now this drug is having a cidal action. Streptomycin, which is again bactericidal, it is used as a reserve drug. It may not be included in the initial therapy for tuberculosis. So tuberculosis, which has the initial therapy as well as the continuation therapy. So in the initial therapy where all the first line drugs are generally used, so streptomycin may or may not be included in the initial therapy for streptomycin. Now coming to the treatment of oral candidiasis. Now you can be asked about a short note on the treatment for oral candidiasis. Now here the treatment is mainly topical. You use topical drugs. We use topical drugs like clotrimazole and nystatin. So clotrimazole, which is used topically, a 10 milligram crochet of clotrimazole, which is kept in the oral cavity. It is supposed to be dissolved or sucked in the oral cavity, which is used 3 to 4 times a day. Again, another drug which can be used for oral candidiasis is nystatin, where 1 lakh unit tablet, which is kept in the oral cavity, which is allowed to dissolve slowly in the oral cavity, again 3 to 4 times a day. So this is the oral treatment for oral candidiasis. Now, in case the treatment, the infection does not subside with this topical treatment, we generally use systemic therapy with fluconazole, which is given orally in the dosage of 150 milligrams per day for a period of 2 weeks. So here fluconazole is generally given to patients who are not responding to the topical treatment as such. So that's it about the treatment of oral candidiasis. Now coming to the malaria treatment of uncomplicated malaria. Now here generally earlier we were using chloroquine for this regimen, that is 600 milligrams of chloroquine was given stat once the diagnosis of malaria was done, and then it was followed by 300 milligrams, which was given on the same day after 8 hours, and then for the next 2 days 300 milligrams, which was given. But nowadays, of course, this was combined with primaquine 15 milligrams daily for a period of 14 days. This was the therapy which was given earlier, but nowadays, because of the chloroquine resistance which has been developed, the other drugs like artemisinin based combination therapy, which is given, which includes artesunate 100 milligrams BD, that is twice a day for a period of 3 days, which is combined with sulfadoxin 1500 milligrams plus pyrimethamine 75 milligrams as a single dose. So this combination, which is used nowadays in case of chloroquine resistant malaria. Then we come to this drug, which is metronidazole, which we have already seen the uses of metronidazole. It is a first-line drug in case of amoebiasis, in case of trichomonas vaginatis, giardia lamblia, and in case of anaerobic infection. So that's it about the antimicrobial drugs. Now we'll see the autocoids. Now in the autocoids, the H1 antagonist or the conventional antihistaminics, which they are also called. That part is important in the autocoid. So we'll go through fast. We'll see in brief about the H1 antagonist. Now on this topic, you can get a full question on the classification of H1 antagonist as well as the uses and especially the uses which are more important, and of course the side effects. So coming to the actions of the H1 antagonists, which are also called the conventional antihistaminics. Now these drugs, the actions of these drugs, they antagonize histamine. Now histamine, which causes bronchoconstriction, and it also causes the triple response, which includes the wheal, flare, and itch, and it also leads to a fall in blood pressure. So all these are antagonized by the antihistaminic, the H1 antagonist or the conventional antihistaminics. Then these drugs also have an anti-allergic action. These drugs, they suppress the immediate hypersensitivity reactions or the type 1 reactions. They control the urticaria, itching, and the angioedema, which are the symptoms in this type 1 reactions, which occur in the type 1 reactions. So that is about the anti-allergic action. Now on the CNS, these drugs, especially the older antihistaminics, They cause CNS depression because they pass the cerebrospinal fluid, enter the brain, and cause CNS depression. Whereas the second generation antihistaminics, they do not enter into they do not penetrate the brain, and therefore they are non-sedating as such. Now, these drugs, the antihistaminics, they also have a anticholinergic action. Now, on based on the anticholinergic action, they are classified into those with high anticholinergic action, like drugs like promethazine, we have diphenhydramine, we have dimenhydrinate, we have pheniramine. Then those with low anticholinergic action, drugs like chlorpheniramine, we have hydroxyzine, we have triprolidine, cyproheptadine, and then there are the drugs with minimal or absent anticholinergic actions. These are generally the second generation ones, the newer drugs with absent anticholinergic action. Drugs like fixofenadine, we have estimizole, loratadine, cetirizine, mesolastine. So these are this is the classification based on the anticholinergic action of the antihistaminic drugs. Now, coming to the classification of the H1 antihistaminics, again, it is very important. They are classified based. They are classified. Uh, they are classified as old generation or the first generation and the second generation antihistaminics. Now, again, based on the sedative action, they're classified as highly sedative, which include drugs like diphenhydramine, dimenhydrinate, promethazine, hydroxyzine. Then there are the drugs which are having a moderately sedative action, drugs like pheniramine, cyproheptadine, meclozine or meclizine, and we also have sinarizine, which is having a moderately sedative action. And then there are the drugs with mild sedative actions. Those which are there in this group are drugs like chlorpheniramine, we have dexchlorpheniramine, and we have triprolidine and clemastine. So these are the drugs with mild sedative action. So that is about the older generation. Then we have the second generation or the newer generation antihistaminics, which include drugs like fixofenadine, we have loratadine, we have desloratadine, we have cetirizine, levocetirizine, we have azilestine, mesolastine, ibastine, and we have ropatadine. So all these are the drugs which are included under the conventional antihistaminic drugs. Now, side effects of these drugs, they mainly cause sedation, which is a major side effect related to the older generation ones, and they cause impairment of the psychomotor performance. Therefore, these when the patient is taking these drugs, the patient has to be cautioned about driving vehicle or operating machinery which requires constant attention. The second generation antihistaminics are free of CNS effects, so they can be used in such conditions. Again, anticholinergic side effects are there with especially the first generation or the older antihistaminics. That is dryness of mouth, alteration of bowel movement, urinary hesitancy, and blurring of vision. So these are the anticholinergic side effects which are related to, especially to the first generation antihistaminics or the older generation antihistaminics. The second generation antihistaminics are those antihistaminics which are those H1 antihistaminics which have been marketed after 1980. Now with these drugs, CNS depression is less. They cause less CNS depression, and therefore less of sedation is there with these drugs. Again, they do not have anticholinergic side effects, and also there are additional anti-allergic mechanisms with these drugs apart from histamine blockade. So the principal indications of these drugs are in case of allergic rhinitis and conjunctivitis. They control the sneezing, the runny nose in these conditions, and also the red watering itchy eyes, which are the symptoms in these conditions, allergic conditions. Then these drugs are useful in case of urticaria, atopic eczema. They are also useful in acute allergic reactions to various drugs and foods. So these are the major principal indications of the second generation anti H1 antihistaminics. Now coming to the uses, overall uses of the antihistaminic drugs. Now these uses are generally asked in the exams. What are the uses of the H1 antihistaminics when a full question is asked? So these drugs are useful in allergic disorders, which you have already seen, and also other conditions involving histamine. For example, in insect bite, where histamine may be released, or in case of IV poisoning. These drugs are also having a prophylactic value in blood or saline infusion induced rigors. So rigors which are caused because of the saline being induced or blood being induced. So again, these drugs can be used in such conditions. Then the pluritides, these are the major indications of the H1 antihistaminics. The older ones, especially like chlorpheniramine maleate and diphenhydramine, are the drugs which are commonly used in various in case of pruritus. Then in case of common cold, now these drugs, they have a symptomatic, they cause a symptomatic relief in case of common cold. Again, motion sickness, these drugs are quite helpful in motion sickness. They prevent motion sickness when taken half an hour or 1 hour uh, before traveling. Again, promethazine, this drug is useful in vomiting of pregnancy or morning sickness. Again, in case of drug induced or post-operative vomiting, this drug is quite helpful. Promethazine will control the vomiting in such cases. The other indication of the H1 antihistaminics is in case of vertigo, where generally we use the drug sinarizine. Then, in case of pre-anesthetic medication, promethazine is one of the drugs which is used in the pre-anesthetic medication, which is given before different types of surgery. Cough is again one of the uses. It is used as antitussive drug. It gives symptomatic relief. It is one of the ingredients. It is included as one of the ingredients in the various cough preparations which are available in the market, either chlorpheniramine or diphenhydramine or promethazine. So any of these ingredients may be included in the various cough preparations which are available in the market. Parkinsonism, again, this drug promethazine gives a symptomatic relief uh, to the patient in case of Parkinsonism. Good acute muscle dystonias, which may be caused due to antiemetic or antipsychotic. So here drugs like promethazine and hydroxyzine will control the acute muscle dystonias due to these drugs. Last and but not the least, these drugs are used as sedative, hypnotic, and they also have a anxiolytic action. So that's it about these drugs. Thank you.